Are you conscious about the hump visible on your upper back when you look into the mirror? Are you slouching your back too much while sitting? Hi, I am Dr. Sheetal Mundhada, and in this video we are going to talk about what a humpback posture does to your body and how to treat it. Your upper back is also called the thoracic spine. Is the longest vertebrae in the spine. It attaches to the ribs and it helps the body in twisting and bending. Thoracic vertebra has a normal curve coming out if we see from the side. This curve might be troublesome if it comes out too much and form a round, large C-shaped curve. This change comes to your notice when you find difficulty in performing your day-to-day activities like bending forward, backward, twisting, or even pain in your upper back or breathing difficulty. You might be at a risk of developing a kyphotic spine if you are constantly in a poor posture, which involves your head and shoulders coming in front. Carrying overloaded backpacks, poor workstation posture, low calcium levels, family history, or nerve muscle incoordination might develop this hunchback problem. Recent research suggests that postural kyphosis, which is caused due to a poor posture, can be corrected with the help of physiotherapy with proper exercise routine. Another type of kyphosis is the Scheuermann's kyphosis, which is much more severe and causes the vertebra into V shape. Kyphosis can be present in the children at the time of the birth, which can be visible as the child grows. Postural correction exercises are the crucial part of the treatment plan in the kyphotic spine. Correcting the rounded shoulder by stretching a pectoralis muscle and squeezing the shoulder blade is important. Releasing the tightness of the muscles of the upper back between the shoulder blade can be done on your own with the help of the firm ball or a foam roller. Strengthening exercises for the core muscles will keep the back in the normal alignment. Strengthening of upper back muscle will keep the shoulder blades in the neutral position. Eliminating a postural pain and discomfort are important to correct a hunchback posture. In much severe cases, braces can be worn temporarily to correct the alignment of the spine to avoid the hunching of your upper back, although the bracing does not strengthen the muscles affected. I hope this video helped your hunchback posture better. Don't forget to leave a comment to share your views and queries down in the comment section. For more such educational videos, don't forget to subscribe to your physio.